The London Bridge Sports Medicine Podcast. Medical news, health, fitness with Dr. Ajai Seth.
Hiya, today we speak to Pat, who is a golfing physiotherapist. We chat about the demands of golf on the body and common injuries that golfers have, but more importantly, what you can do about them. We talk about how the game has changed over the years with respect to technology and how strength and conditioning training should be a vital part of any golfer's exercise routines. If you feel you're suffering with a golfing injury or want to find out more, please do not hesitate to get in contact with us. Hope you enjoy listening. Right, hi, Pat. Welcome to LBSM's Ask the Expert. How are you doing?
Yeah, good, AJ. How are you?
Not too bad at all, mate. Not too bad. Thanks so much for coming on. So I wanted to bring you on because we obviously see a lot of patients together in the golfing sort of sector. And I thought it would be really good just to get our heads together and just chat through some of the issues around golf and, you know, some of the patients we see. And I think there'll be a lot to sort of gain from patients listening to this in terms of they're either a golfer or they're quite experienced golfer or looking to take up golf, and how they can improve their fitness, how they can improve their health and just stay injury free. So let's just give us a bit of intro about yourself and your golfing sort of pedigree.
Thanks a lot. Yeah, I am a physio. As you know, we've worked on a few golfers together, and I've physio 12 years. I've kind of gone around the houses a little bit in terms of working for different sports and in private practice. But actually, I'm a big golf fan. I think there's a huge trend for it at the moment. Obviously, with lockdown, I think golf got a big burst in terms of activity levels. And over the last couple of years, I think there's about 50% memberships have kind of increased. And certainly where I live in Surrey, which is a huge golf hub, it's really hard to actually get membership now in terms of golf clubs. They're all stopping their membership. So, But just through that passion, I then decided to kind of specialise a little bit more in treating golfers, just purely through interest. And as a result, it's certainly a bit of a niche where there aren't that many clinicians surrounding where I live and treat patients that have that specialism. So I felt like it was quite a unique specialism to have, and so much so that I've actually started my own golf injury clinic, which is based in New Malden in Surrey. It's based at a driving range called World of Golf London, and it's just a clinic room with a gym in it, really. And like you said, I think there's certain trends at the moment with these big golfers in the pros at the moment who are spending a lot of time in the gym. Yeah. And so I think there's definitely a bit more of a trend where the lay golfer or the amateur golfer, their knowledge base is certainly improving, and they know the value a little bit more in terms of getting strong and being able to hit the ball further, or being able to cope with hitting regular balls and repeat practice a bit more. So yeah, it's an interesting area at the moment. I certainly feel it's going to get even more popular amongst amateurs and taking it a little bit more seriously.
I think you're absolutely right. From the point of lockdown has really changed the landscape of it, isn't it? So golf and tennis were two sports that obviously threw off the rails because, you know, they're outdoor based, and as soon as restrictions sort of lifted, a lot more people went to them. So either as newbies or obviously as experienced players already. I just would say I'd enjoy working with Pat. I refer patients to his clinic. I've spent a long time working in golf on myself at the European Tour and the Senior Tour. And it is really difficult to get that golf expertise because it's not it's not a traditional sport to be involved with in terms of the biomechanics and the sort of analysis that needs to go on. And from a physiotherapy point of view, I think there are certainly unique challenges that people might not traditionally think when you think of football, contact sports such as football, rugby, you know, lots of injuries, lots of high contact velocity tackles, where golf is, you know, quite a perceived to be a bit of a sedentary sport to some degree. But actually, you know, tell us about what you feel the demands on the body are from a golfing point of view and how that's changed over the years.
Yeah, it's interesting because I think actually now when I say that because I've played lots of sports over my lifetime, but actually now purely concentrate, say, on golf and in the gym and keeping fit. And everyone seems to, those that don't really know anything about golf will just say, "Oh, isn't that an old person sport?" Or and it has this real stigma about it, but actually it's completely the opposite. And there are a lot of areas of the body that can particularly become injured in the golf swing, in the golf performance. And I think now, certainly with the increase in professionalism of the game, you can see a lot more amateurs now being influenced by the pros and taking time to be in the gym, etc., and getting stronger. So it's interesting because there's a study in 1990, and it showed that the amount of force through the elite players going through the spine is about the equivalent to 750 kilograms. So when you hit the ball, so it's a huge amount of force, and obviously that was in 1990. So the pros now will be developing even more force going through that particular area, and obviously the amateurs will be less, but it'd still be at least 3 to 4 times body weight in terms of through that swing pattern. And I think now there's a really interesting analogy from the S&C guys, the strength coaches, on the European tour, where they talk about a car analogy, where if your players now want to try to develop as much force as possible when they try and hit the ball harder. And if they're trying to increase the force, then that's like they're trying to increase their engine size. But if you want to increase your engine size, then what's really important is that you have also alongside that a really robust and a really stable chassis as well. And I think nowadays that's what pro golfers are trying to develop. Yes, they're trying to develop high amounts of club head speed or ball speed to be able to hit the ball further, but actually a lot of their resistance training in the background they do is to try and actually have a baseline of strength so they can cope with those forces that they're trying to generate. And it's the same with amateurs. It doesn't matter at all that what skill level you are. If you're still trying to hit the ball fairly hard, which most amateurs are still trying to do, then you need to develop a body which is actually able to cope with those forces. And I think that's where the demand has certainly changed. People are probably taking that a little bit more seriously, but maybe they don't quite know that, they kind of need to develop that strength element to their body as well. And also equipment is just flying through the roof as well in terms of technology, etc.
Exactly. And that was exactly what I was just about to say, that, in some respects, the technology of the clubs allows you to hit further with less ease, but at the same time, that comes with a lot of responsibility almost to even be more careful and vigilant around your chassis, as you describe it, in terms of making sure that you've got the capability to deal with that new better equipment that's coming out and allows you to hit further and faster.
Exactly.
Particularly if you're someone who's just hitting the range, and you're really trying to give it some, and that's your release for the week, for example. Just making sure you've done the groundwork for that point of view is really key. And
exactly,
you talked about so the game is physically changing at the sort of amateur and pro level. We were just having a chat before we came online, really, just about how we think some of the pro players really changed that. Rory McIlroy comes to mind. Would you say that is almost a prerequisite of the game now? Of if you want to stay injury free, you want to be good, you have to have a good strength and conditioning program. And that is obviously translatable to the everyday golfer.
Yeah, I mean, I'm certainly biased towards that certainly being a prerequisite, just because that's the kind of environment I work in. But I would genuinely say, I think there's definitely a growing amount of evidence to say that if you are stronger, then the prevention of injury side is better. And then at the same time, I think if you want your performance to be better as well on the golf course, then there's certainly evidence showing that if you are stronger and you're able to develop and expose more forces on the golf ball, then that will reduce your handicap overall. And actually, certainly on the pros anyway, the guys that hit the ball further, they are now able to earn the more money. So there is a little bit of a relationship between all of that. There's also a relationship between a lot more evidence coming out that if your lower body and is stronger and you develop more explosive forces, then that will increase your club head speed as well, which then potentially has this relationship with having a better performance. But on the flip side of that, there are golfers obviously as well who can hit the ball not quite as far as the leading players, but they can, get round, and they're still decent golfers as well. So I think there probably is an argument on either side, but I would say generally, I think if you want to have those slight marginal gains, then there's really no harm in terms of getting yourself stronger and spending some time in the gym just from a health point of view anyway. So I think it's more importantly, beneficial.
If you're wanting to show off on the range or on the course in front of your business bosses and stuff,
then that's always beneficial.
Right. Yeah, and I think
earning some money on the course.
Yeah, exactly.
The other fact about that though as well is that most driving ranges now will have all their stats as well available as soon as you hit the ball. So certainly the person next to you in the bay will be looking at your TrackMan type and your and seeing if you're duffing it or not. So you might as well get better.
So we'll come back to strength and technique actually, but let's just talk about injuries if that's all right. So a lot of the patients who come to me in the clinic with a golf-related injury isn't typically what people might think. Oh, it's golfer's elbow is a term that's out there that really corresponds to elbow injuries. And actually, people who play golf to a decent level, that's not normally what they're coming in with. It's more, most of the time, to do with core-related issues. And by that, we're talking about the pelvis, the lower back, or the lumbar spine, and the way they integrate with each other. So just take us through your opinion on the different sort of common injuries you see, and the different sort of injury trends and patterns.
Yeah, it's interesting. I think, the old elbow commonly comes to mind straight away just purely because it's named golfers and it's just easy to remember. It's certainly a factor. I know, certainly from my experience treating golfers, I've literally treated everything from the neck and headaches down to a toe being an issue, and certainly everything in between. So you can have any injury as you play golf. I'd say the incidence certainly is in amateurs anyway. Is the lower back is probably the most common. So there's an interesting article by Andrew Murray, who's the lead doc on the European Tour, and it's about 18 to 36% of amateur golfers, if they're injured, will probably get about some lower back pain. Elbow comes to about 8 to 33%. And wrist and hand is also common. That gets between 10 and 32% of golfers. And then the shoulder equally is between 4 and 18%. So they're probably the main injury focused areas. Although I'd say certainly in my experience, golfers who have a shoulder or a wrist or hand or elbow, it's usually a compensation factor. So it might have been that they're working too much, they're developing too much of the swing forces through those areas, when actually what they should be developing, and this is what I say to the golfers, is the bigger muscles. So the bigger muscles of the trunk, the pelvis, the hips, and the legs really should be developing the force a lot more. And the elbow, the hands, the shoulders should then be almost following suit. And I think a lot of golfers will flick their wrists a lot more, or certainly technical points, they might activate those areas a little bit more to generate that force, because they might be overcompensating for a lack of force development through their trunk or their pelvis or their hips. So certainly
so it's not just a biomechanical thing. It could be a weakness in the kinetic chain. So it's not a technical thing almost. It's if they're lacking in core strength, lacking in the bigger muscle groups, they are overcompensating with the smaller muscle groups.
Definitely, because it's almost as if our body goes into the areas of least resistance. And so it's to do with mobility as well as strength as well. So if they're unable to move or generate force through a certain area, say their mid back, and their hips, which cause most of the rotation element, then they're going to try and get that from their shoulder or their elbow or their wrist, where the movement is extremely flexible. So yeah, I think they're certainly the most common injuries here, and the neck is also very common. But a lot of times golfers get so much better if you just try and do some strength training and you do some resistance training with them. Once you've got their pain levels down a bit. And then a lot of times we look generally at their volume of practice and their volume of play as well, which is a big factor. And the fact that if you don't want too many changes in their equilibrium when they're practicing. So if they're practicing too much and there's a bit of a spike in their training, or if they've changed their equipment, or if they're looking at certain different kind of swing changes or things like that, they're always risk factors for me for injuries as well.
Okay, so that's interesting. So we've talked a lot about strength training and training the big muscle groups to try and keep that chassis nice and strong. Volume, you are right, is absolutely another issue, and I think that's with any sport. If sport or golf for you is an opportunity to release, beneficial for mental health, beneficial for lots of other positive health factors, people will go to it and people will use it, and they'll use outlets like the driving range to improve their health and feel they're looking after themselves. So from that loading point of view, what are key sort of things people can do just to keep a watchful eye on that? An obvious one is balls hit at the range, for example, but is there anything else people can do just to make sure that they are getting the volumes right within their golfing week or calendar?
Yeah, I suppose it's all down to what their body's used to. So I would say if you're used to maybe hitting once a week, then but you want to increase that, then I would probably use maybe the 10 or 20% rule. So where you're increasing the amount of the frequency that you go, or the amount of balls that you hit in each session, only by increasing it about 10 to 20%. And I'd say generally per session, it's probably wise to hit between maybe 50 and 80 balls is probably enough. But again, this kind of depends on the standards, because if you compare an amateur who works at a desk all day, 8 hours a day, and then goes and hits balls maybe once a week, versus a pro who's on tour and hits balls every day of the week, they will hit a lot more balls versus the amateur. But that's purely because their body is so used to that, and they're a professional athlete who is accustomed to that. So I'd say generally I probably wouldn't hit more than between 50 and 80 balls, and you've got to make sure that when you're hitting balls it's very varied. So you're using different clubs. You're also warming up is really important. So there's good evidence to show that warming up actually reduces your injury risk. Maybe 15 minutes beforehand, doing a few gym type exercises is really good, and a few club swings. But then I would work up from, say, pitching wedge, where you're doing maybe half swings, then up to your driver, rather than a lot of golfers will just come straight off from the desk out of the car and then just start hitting maybe 50 balls with their driver, which
and it's amazing how that is a Goldilocks zone for injury, isn't it?
Exactly.
Straight out of the desk onto the course, onto the range. You get
and
your
then just smashing
out.
loads of balls. Exactly.
Yeah.
So I think it's just being sensible, really, and it's building up, almost using your your shorter irons to actually as a warm up, almost towards then the more forceful shots, which are your longer irons and your woods and your driver. And I'd probably do maybe 10 balls each club. And then if you're going up through the balls, then up through the clubs, then maybe you could leave 20 to 30 with the driver, or depending on what you're prioritizing for that session in terms of what you need to work on, etc. So it differs for every person, but I think on the whole, it's worth sticking to some parameters and not just exploding and have a huge spike in your volumes that you're doing.
And we mentioned technique before, didn't we? And we said, a lot of the times people have changed technique, and that's a risk factor for a potential injury. or they're trying something new with their swing. And often that's on the back of a professional. So that, they're getting a lesson and the coach has said to them, you know what, why don't you try this? Or a classic one I hear all the time is use your hips more. So, people have never really known what that means, but they're told to use their hips more. They try and modify their swing and then something flares, something goes in the back. So do you have any, obviously a lot of the time when I refer you someone for an assessment, do you look at any key pointers in terms of their technique or from a biomechanics of a swing point of view to see what you could help with and what you could change?
Yeah, I think it's a tricky domain for a physio who doesn't necessarily have that huge technical knowledge base. But what I try to do, certainly where I work at World of Golf, is I've got a really good relationship with some of the pros there, and I'll get referred some patients, some golfers from the pros. And what I like is then being sent a video of their swing from the pro before our assessment, and then that gives me a basis of what their swing looks like, and then the pro will tell me what aspects of their swing they're working on at the time. That then gives me a good area of looking at certain usually rotational elements of the body, so the hips and the spine are really key. So then in our assessment I'll look at if there's any big restrictions in those areas. Obviously there's, again, it's not black and white, so everyone's very different. But those are probably two key areas I'll look at rotational elements and see if there's any physiological restrictions. Because if someone is really restricted in their hip mobility, and that is just how they're made, then no matter how many stretches or anything I give, if their ball and socket literally does not want to go any further than their body allows, there is a limit to how much rotation they'll get through their hips. So for me, it's then really important to relay that back to the pro and say, look, these are the sort of elements that actually are quite restrictive for that golfer. And regardless of how much rotation you're trying to get out of your hips, there's going to be a limit. And as a result, if you're then trying to really ram those joints and try and get loads of rotations through an area that really doesn't want to rotate, that potentially can lead to injury. So there are lots of little techniques you could have. Certainly for hips is just having your feet a little bit more turned out. That gives you a lot more space in their hips. I'd certainly look at how much wrist is involvement as well. So if they've got a tennis or a golfer's elbow type symptom, I'm always looking for how active they're through the wrist and how much movement they're using through the wrist to generate ball speed, etc.
And grip tightness as well, a big factor, right?
And grip tightness is a big factor, which for me is then more difficult to judge, and that's again then where the collaboration with the pro is really important, because they actually will see them face to face gripping their club and know whether it's excessive or not. And I can do some strength monitoring, so I've got a grip strength monitor, which is a nice indicator for how much strength they've got in the right hand versus the left, and that gives me an indicator whether it's under strength, etc., and we can work on that. So there's lots of different areas, like we've said before, where if they're overcompensating for one area because they're trying to slightly change their swing pattern, that can then slightly lead to injury in those specific areas. So I think it's all based on the collaboration with the professional they're seeing, and also what area of the body is the injured area, and looking really at the body as a whole pretty much, and how they're moving through those areas.
And I think you're spot on in terms of what we call an MDT, so a multidisciplinary team. And from an MDT point of view, I think the ultimate MDT for someone who's suffering with a golfer injury is a sports physician, yourself, and a coach. Because just as you've mentioned, is there anything structural that is limiting motion, limiting movement, causing pain? And that's always worth identifying first. And that's where the usefulness of medical interventions or scans or for example, an MRI of the hips or MRI of the spine to actually understand structurally what's possible, along with a good clinical assessment and examination. And then if I can work that patient up and hand over to you and say, look, this is what I'm thinking is capable or this patient can do. And then you add on the biomechanical assessment, and then the coach adds on the coaching assessment. I think that is a really well-rounded, comprehensive workup for someone who's got a golfing injury, rather than, dosing up an anti-inflammatories, thinking things will go away, or just trying to change your technique yourself. So
Yeah.
I think the key is there's a lot to it, isn't there? And if once you break down the detail of all these different areas, there's lots of things that patients can optimize for themselves. But it's just having the knowledge that's key in the first place.
And I think it's just really important as well, is that everyone's got their specialty as well. So for me as a physio, I'm looking from a biomechanical or a body point of view, and working out limiting factors. From the coach's point of view, he's very specialty in terms of the swing. So actually, as a collaboration, and yourself, AJ, as well as a doc, we can all kind of work together to work out, okay, well, what's the best management plan for this person if they have got a sore hip, but they're stiff in their hip, but they're still trying to optimize their golf swing. So and I think a lot of golfers like that as well, because they're getting looked after, and they've got a few people talking about them and trying to collaborate to help them kind of move forward. And I think it works really, really nicely. I certainly wouldn't try to be an expert in the golf swing, because that's just not my. That's just not my. I just don't have that knowledge at all.
And I also think just one of the sort of more final points I want to say about golfers, or people who end up seeing us as patients, is a lot of people think they can put up with stuff. So, oh yes, they've got a bit of a niggle on the back, or they've got a bit of a niggle on the shoulder. Oh, I'll just play through. I'll just keep going. That's not golf specific. That's all sports. But actually, the sooner you get things looked at, one, the quicker you can get it sorted and have a better understanding of what you do need to change. But secondly, you stop it becoming a chronic issue, and then it's so much easier to treat when things are just a little bit of a niggle rather than a more serious injury. So I think
Definitely.
I think part of the reason of getting this out there as well is to make sure people who play golf are really aware that they shouldn't be putting up with niggles if it's affecting, one, their game, and secondly, their quality of life. And there's a big tendency for people to downplay niggles as well, to say, oh, it's only golf, it doesn't affect me any other time of life, or it's not actually that important. Where, actually it is. If you've taken the effort and the time to go play the sport, get out there, invest in clubs, all that sort of stuff, you should be wanting to perform your best. And also you get all the benefits that come with that. So if your golf is better, your mental health will be better, the enjoyment of the game will be better, everything just progresses on and on. So I guess one of the key things is just get things checked out as soon as possible.
Absolutely. And actually, like you said, it's so much easier for us to help a golfer if they've got quite a niggle that's not been there for very long. It's much easier to nip it in the bud than something that's been lasting for ages. The other thing that I find fascinating as well is that golfers they're very much into investing in quite expensive equipment, but then when it actually comes to their body, the investment actually is a little bit less involved. They're not quite sure whether they need to, and obviously that's subjective, but I'd say generally, the other thing about focusing a little bit more on your health and your strength training and your swing mechanics, etc., is basically, like you said, you could be pain free. You could actually not play golf with pain at all, and you could play golf for the rest of your life with pain free. And I think that's quite a big point as well, is as long as you're willing to spend a little bit more time on it and a bit more investment in it, basically. So no, and on the whole, golfers, I think they get better quickly, really, really well. It's just about having that team approach and making sure that they're invested in it, really.
I think that is a great place to leave it. I mean, lots of people will be falling off their chair hearing that they can play golf pain-free. So, but that is
exactly.
certainly true. Pat, Thank you so much. Just before we go, I'm going to put you on the spot. And what's your single most important tip for anyone who's got a golfing injury or, are struggling with some form of pain or illness during golf?
They need to get in the gym and see someone who can give them some structure in the gym to make their swing and their performance so much better than it was, because they'd be amazed how many gains they can get just by doing about 3 times a week strength training. It'd blow their mind.
Brilliant. Pat, thanks so much, mate. Please
Pleasure,
do come
AJ.
back. Please do come back another time. We can chat more about golf.
Of course, I'd love to. And if anyone wants to find me, they can take a look at my website, which is drivingperformancegolf.com.
And I should have said the link will be in the comments, so you just feel free to click on that. No worries,
Thanks, mate.
Take care. See you soon.
You too. Thanks, mate. Bye.
Thank you for listening to LBSM's Ask the Expert series. We really hope you enjoyed listening. If any of the topics discussed are relevant to you or you want to find out more, please get in touch by phone, email, social media, or visit our website. Thanks again, and see you soon.